Hello, my friends. Just want to be able to share some things that I've been exploring as a physician, as a human being. There are certain things as I'm getting older. Technology keeps bringing new advances, and I'm always trying to explore or be curious about things that may actually work well. In particular, when I am doing my daily activities, I'm always curious, like, how much am I burning? Am I getting enough sleep? How's my heart doing? So many different factors that, if you don't really pause for a moment to think about it, you'll just kind of neglect it. And I do like to have more data for myself, like what am I doing throughout the day and my sleep, or what I can be doing to kind of optimize what I do for myself, for my own health. And this is really a strategy for me moving forward, because at the age of 54 now, before I know it, the 70s will be rolling right up on me. So one of the things that I like to know is, am I getting adequate sleep? And my activities during the day, are they appropriate, or am I burning myself out? The adage of burning the candle at two ends. I'm trying to avoid that because I see, as I get older, there's a potential for harm. And if I don't take preventative measures now, then I'll pay for it later. So using different devices, it's a matter of what works well for you. I'm very bare bones. I never have had a watch. I don't wear jewelry. I don't really like anything that kind of is cumbersome. So to make it as simple as possible, there's this company called Oura. And Oura has actually designed a ring. For me, I'm not a jewelry person, but I avoided this concept because I didn't want a ring. But having worked with other colleagues and actually patients who've tried this, I thought I'd give it a whirl. So the Oura is a ring. When you go onto their website, they will send you a kit. The kit is essentially for you to size your finger, so that then they can send you out the appropriate size ring so it works well as a monitor for you. This is the part that freaked me out the most. As a person who does not like to wear jewelry, I'm very apprehensive about anything that's too big and too bulky, or too loose and it falls off. At the same time, I'm mildly claustrophobic. So the thought of putting on a ring that I wouldn't be able to slide past my knuckle really freaked me out. So it took me a little bit of just kind of calming down and understanding what I was trying to do. I was able to select the size. I literally had this box with me for about 3 months. As soon as I got it, I tried it on. I was like, nope, not for me. But then I finally committed. I chose a ring size 9, which is the right size for me. Not too loose, not too snug. Sometimes you can actually just wet the finger and slide it on. You want the contacts for this to be appropriate so that it's reading the right way. So this is the size for me. And once I signed up, I basically provided that size. It was the correct size. And essentially the ring came within about a week. There's a variety of different colors you can choose from. For myself, it's silver. So you can see that this is a small device. It is a ring. And inside you'll be able to see all the electronic components. This is a device that will monitor your activities throughout the day, and during your sleep. It'll tell you your heart variability rate, your pulse. It also has a feature now, which is supposed to be released in 2022, to measure your oxygen level, which is important if you're doing any physical activities or when you're asleep at night. So sliding this ring on, I'm ready to go. I don't have to really do all that much. It's on there firmly. Occasionally I'll just kind of fidget with it, and sometimes I'll freak out when I can't pull it out, and then I just use soap and it comes off. But it's not like wearing a watch, and it's not like wearing a heart band. So for me, I've been wearing this now for a month. And I get comments, oh, when did you get married? And I was like, well, no, this is actually me being a geek. And so this device is actually just monitoring me. And it creates a certain sense of novelty for some people. I have other physician colleagues who've used this. It's right by the bedside. There's a charger and just a USB cable. It charges and lasts for, I would say, about 4 to 5 days. In the new updates, when they have the oxygen sensor, then it's supposed to be maybe not as long of battery life, but still that's sufficient. I can easily charge it just like I would charge my phone as I go to bed at night. And I wake up in the morning, the first thing I do is I actually check the app. And the app is easy on iOS and Android. It's pretty self-explanatory, and I'll walk through a little bit of what I usually look at and how to interpret the information. But it's useful because it just gives me more insight. It gives me a moment to pause. It gives me biofeedback, if you will, so that I can say, hey, you know, last night I didn't sleep that great. What's today gonna look like? Is today gonna suck, or is it gonna be, you know, I have enough energy throughout that? Or do I need to slow down a little bit? And those subtle things actually have a tremendous impact long term. Sleep, as it's monitored, I can clearly say that my sleep needs to be improved. Part of it is being humble for the information that you do get. You do need to accept some of the things that it shows you and try to work out strategies in your life, your lifestyle, that you can actually make a fundamental change. I would say that the biggest thing for me has been my sleep, and being mindful of that is extremely important. So we'll dive in a little bit more into the app so that you can see that for yourself. Again, this is not meant to be any endorsement from Oura. This is essentially me just fidgeting around with new technologies and sharing that with you. So let's dive in. So we are currently recording the screen, and as you can see, I have all my different health apps in one folder. It looks like a mess. Probably need to remove some, but it's on there. And you'll see Oura is the app for the Oura Ring. There is communication between the ring and the app itself. It will let you know when there is an update. Right now we have an update, and we'll just do that. That's really for the app itself. And it's kind of like my Tesla, you know, anytime I need anything, I just, you know, there's going to be an update or anything. It's like the product is improving over time. And you have to think that with this device, you're able to send your data in, and it's collecting or harvesting data from many different users. So just like the Tesla navigation system, this app is gathering data, data which really I think will benefit more people over time. So what's happened with this app is this is just today's schedule. It will show my readiness for today, which is at 77, and then my sleep, which is 84, which is fantastic for me, and then what my progress has been so far throughout the day. It'll show everything over the nighttime period, and as I wake up in the morning, what my heart rate is, and it'll give suggestions. So let's just say if I wanted to go in and take a look at my readiness, it provides me more information about how to listen to my body and take that information and adapt some changes. When we look at the readiness score, that's like how ready are you for the day? You know, today is Monday and I'm just a little bit above 76. You can see on Friday I was burning the candle at both ends, and so that potentially is a problem. So that information in and of itself is useful. And I like to think that, you know, over time I will be able to use this information and not stress my body out unnecessarily. So then we can also take a look at sleep, which is extremely informative because it tells different phases, like when did I start to fall asleep, sleep latency, how long was I in deep sleep or REM, light sleep, all of that information, which, you know, again, you know, sleep is a vital function. It's an opportunity for the body to rest, and you want to maximize that to get the full benefit. You can see last night I did 6 hours and 50 minutes, and you can see patterns throughout the night in terms of deep sleep, light sleep, and REM. When they add on the oxygen sensor, then we'll be actually able to see how my oxygen level is. This is a device, if we do this during sleep, we can see how low it gets, and in some cases may be a predictor for sleep apnea. I'm not saying that that's the case right now, but, you know, future iterations, future use, it will be extremely important. So, and then in terms of activity levels, what am I doing to burn calories throughout the day? Again, I'm able to understand a little bit better about how my activity is. There are reminders about, maybe you might not want to sit so long, or maybe you want to slow down a little bit. It does give other, features of the app, like meditation, opportunities for breathing, how to improve your sleep. So it's a wealth of information. The Oura Ring itself, when it was first released, both Ring 1 and Ring 2, this app and the ring itself you purchased. Now what Oura has done is they've actually designed it so that it is a subscription. There are a lot of people who have complaints about that. I am on the fence about it. If they will only produce the O2 sensor, I think there's value added to that. I think in terms of the business, Oura, there's been some issues with the CEO leaving and now there's a replacement. But again, this is just an example of a device and its use in an application. Oura is just one of those. There certainly will be plenty more. So I encourage you to think about what you can do yourself to monitor, how you feel throughout the day, get a sense of, where you are at. If you're stressed, what you need to do to remind yourself to kind of slow down. All very useful information. So I must say I've used the Fitbit, I've used, Android Watch, Samsung Watch, a variety of, even Apple Watch. Being who I am, I'm not a fan of certain form factors, but for the Ring right now, I can tell you I am much more inclined to use this than anything else. So I'm very excited about it. So for everything that we do through Earnest Medicine, we always welcome viewers to have any questions, any products, anything that they might want to contribute, any stories along the way. I will be certainly sharing this with patients and maybe sharing my results with my trainer, Carlos, and others. But I really want to listen and explore technologies like this with everybody out there. So certainly if there is anybody who wants to submit any request for something to be reviewed, or any manufacturers who are interested in their device being showcased in Earnest Medicine or some format to provide a better awareness, we're happy to do that. Thank you so much for watching. And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything, we're happy to entertain it. And this is really about us going on a journey together.